A small volume nebulizer is a device used to deliver aerosolized medications directly into the lungs. It works by using compressed air or oxygen to turn liquid medication into a fine mist that the patient inhales. SVNs are commonly used in acute care hospitals, emergency departments, outpatient clinics, and long-term care settings to treat a variety of respiratory conditions. Indications for SVN therapy include patients who require inhaled medications to improve airway function. These include patients with asthma, COPD, bronchospasm, wheezing, or increased airway resistance. The goal of SVN therapy is to deliver medication deep into the lungs, reduce bronchospasm, and improve airflow. Contraindications for SVN therapy are limited but include relative contraindications, severe tachycardia, medication hypersensitivity, inability to tolerate aerosol therapy. These patients should be closely monitored during treatment. There are no absolute contraindications to SVN therapy. However, patients with these relative contraindications should be closely monitored. SVN setup. Now I'm going to explain how to properly set up a small volume nebulizer or SVN. First, I gather all required supplies, which include the nebulizer cup, mouthpiece or mask, oxygen or air tubing, and the prescribed medication. I open the nebulizer cup and add the ordered medication, making sure the total fill volume is appropriate, usually 2 to 5 milliliters, depending on the medication and dilution. Next, I securely close the nebulizer cup to prevent leaks. I then attach the mouthpiece or mask to the top of the nebulizer cup. After that, I connect the oxygen or air tubing to the bottom of the nebulizer. The tubing is connected to a flow meter, and the flow is set to 6 to 8 liters per minute, which allows proper aerosol generation. I confirm that a visible mist is being produced before placing the mouthpiece on the patient. Once aerosol production is confirmed, the nebulizer is ready for use. Now I'll demonstrate how a small volume nebulizer treatment is administered. I begin by positioning the patient upright to allow for optimal lung expansion. I instruct the patient to place the mouthpiece in their mouth and form a tight seal with their lips. The patient is coached to take a slow, deep breath in through the mouth, followed by a normal, relaxed exhalation. I encourage the patient to breathe slowly and evenly throughout the treatment and to avoid rapid or shallow breathing. The treatment continues until the nebulizer begins to sputter and no visible aerosol is present. Throughout the treatment, I monitor the patient for tolerance, changes in breath sounds, heart rate, and any signs of distress.
Introducing this device. Next, I will be explaining the Acapella positive expiratory pressure device. The Acapella is an airway clearance device that provides resistance during exhalation, creating positive pressure and the vibration within the airways. This device helps loosen, mobilize, and move retained secretions toward the larger airways where they can be cleared. The indications for the Acapella therapy include conditions associated with retained secretions such as COPD, especially with patients that have chronic bronchitis, cystic fibrosis, bronchiectasis, atelectasis related to mucus plugging. Ideal patients are those who are alert, cooperative, and able to follow instructions. The contradictions of the Acapella are absolute untreated pneumothorax, active hemoptysis. The initial settings of the Acapella are involved adjusting the resistance dial so the patient can maintain a slow, controlled exhalation lasting about 3 to 4 seconds. Resistance is adjusted based on patient's comfort and effectiveness. Now I'm going to explain how to properly set up and use the Acapella positive expiratory pressure device. First, I ensure the Acapella device is clean, intact, and properly assembled, with the mouthpiece securely attached. Next, I adjust the resistance dial to a lower setting to begin. This allows me to assess the patient's tolerance and expiratory flow. The patient is positioned upright, either sitting in a chair or in a bed, as we see, to allow for optimal lung expansion. I instruct the patient to place the mouthpiece in their mouth and form a tight seal around their lips. The patient then inhales slightly deeper than a normal breath and exhales slowly through the device. I adjust the resistance dial as needed so the patient can maintain a slow, controlled exhalation lasting approximately 3 to 4 seconds while feeling vibration in the chest. This confirms that the Acapella is set correctly and ready for airway clearance therapy.
Part 3. SVN and Acapella used together. Why use SVN and Acapella together, or combination therapy? When the small volume nebulizer is used together with the Acapella device, the patient receives medication delivery and airway clearance at the same time. The nebulizer delivers aerosolized medication to help open the airways, while the Acapella provides positive expiratory pressure and vibration to help mobilize secretions. Now, I'm going to explain how to properly set up and use a small volume nebulizer with an Acapella PEP device together. First, I gather all required equipment, which includes the nebulizer cup, prescribed medication, Acapella device, mouthpiece, and oxygen or air tubing. I begin by adding the prescribed medication to the nebulizer cup, ensuring that the total fill volume is appropriate, which is typically 2 to 5 milliliters. I then securely close the nebulizer cup. Next, I connect the nebulizer to the inlet of the Acapella device, making sure the connection is tight and secure. I attach the mouthpiece to the Acapella device. After that, I connect the oxygen or air tubing to the bottom of the nebulizer and attach it to the flow meter. The flow meter is set to 6 to 8 liters per minute, and I confirm that a visible aerosol mist is being produced. I adjust the Acapella resistance dial, starting at a lower setting and increasing it until the patient can maintain a slow, controlled exhalation lasting approximately 3 to 4 seconds with noticeable vibration. Once aerosol production and resistance are confirmed, the device is ready for patient use. For the demonstration, I'll act as the respiratory therapist. The patient is seated upright in high Fowlers. I instruct them to inhale slowly through the mouthpiece, hold their breath for 2 to 3 seconds, and then exhale slowly through the Acapella device while feeling the vibration. The patient completes 10 to 20 breaths, followed by huff coughing to clear secretions. I monitor the patient for tolerance, comfort, and effectiveness throughout the treatment.